Hello, my name is Whitney Henry, and I am a nursing student at the Indiana State University LPN to BSN program. This is my community health nursing presentation on teen pregnancy prevention. The target audience for this presentation is teens, both girls and boys, as well as parents of teens. The learning objectives for this presentation are that my viewers, upon completion of this presentation, will be able to state who teen pregnancy affects, explain the risks of teen pregnancy, identify ways to prevent teen pregnancy, and discuss actions that can be taken to reduce risk when teen pregnancy has already occurred. Please pause here and take the pretest. Taking the pretest will allow you to assess your current knowledge of teen pregnancy and prevention, as well as assess your knowledge as it grows throughout the course of the presentation. The pretest can be accessed by clicking the link underneath the video. Let's first discuss who teen pregnancy affects. Teen pregnancy or adolescent pregnancy is a pregnancy in girls ages typically 15 to 19 years old, but can be started as young as 10 years old. Approximately 1 in 4 girls will be pregnant at least one time before turning 20. So that's about 25% of our population. Teen pregnancy disproportionately affects girls of teen mothers. They're 3 times more likely to become pregnant in their teens than the normal population. It also disproportionately affects Black, American Indian, Alaskan Natives, and Hispanic girls more than it affects Caucasian or Asian girls. Socioeconomic determinants also factor in. Lower income, lower education girls are at a higher risk for teen pregnancy. An example of this would be girls in foster care are at a higher risk for teen pregnancy. They're at a 2 times higher risk for teen pregnancy than the typical girl. On the right-hand side, you can see a graph that shows pregnancy rates in different ethnicities. There are maternal and infant health risks associated with teen pregnancy. In teen mothers, they are at a higher risk for STDs. They're at a higher risk for high blood pressure and preeclampsia during pregnancy. They're more likely to have pregnancy complications, including preterm birth, and they're more likely to experience postpartum depression. Infants of teen mothers are more likely to be affected by the lack of prenatal care. This can include birth defects, low birth weight, premature birth can be complicated, and of course, pregnancy complications will also affect the fetus. There are many other risks and stressors involved with teen pregnancy. There are many emotional stressors, financial stressors, single parents. Being a single parent can put even more strain on emotions and finances. Threat to education, to further education. Teen moms are 40% less likely to get their high school diploma than the average population. They only get their high school diploma approximately 50% of the time, whereas the normal population gets it 90% of the time, and teen dads are 30% likely to get their high school diploma than the normal population. They can experience lack of support from family and friends, as well as the school system, and childcare can be difficult to find if they decide to pursue a career or even further education. That also includes difficulty getting a job, which contributes to financial stress. All of these stressors and risks are kind of combined and interlinking with one another. So now that we know who is affected by teen pregnancy and the risks of teen pregnancy, let's discuss how we prevent teen pregnancy. First and foremost, education. A solid base in sexual education will give a teen a good stepping off point to protect themselves from teen pregnancies and STDs. There are also birth control methods such as hormonal birth control, IUD, condoms. Abstinence is the only sure way to protect yourself from pregnancy at all. but also avoiding risky behaviors. You can see on the right-hand side, you can see this little graph of the different types of birth control and how effective they are. You can see on the far right that the hormonal birth control pill and the male condoms are the least effective forms of birth control. And this is because they rely on remembering. So human error is the biggest cause of teen pregnancy or in pregnancy in general. So avoiding risky behaviors when involved in sexual encounters. So not drinking, not using illicit drugs, having clear mind, being able to consent. Those kinds of things are going to make it more likely that proper birth control is being used. Again, abstinence is the only way to prevent it, but better than that is educating children in sexual health education so that they can make informed decisions. When teen pregnancy has already occurred, there are ways to reduce the health risks for both the teen mom and the baby, as well as the other stressors. So let's discuss those. First and foremost, prenatal care is going to be the most beneficial way to prevent any health risks for mom or baby. Again, avoiding risky behaviors during pregnancy, no smoking, drinking, use of illicit drugs, and being checked for STDs. Those are all going to be important for preventing health risks. Get access to local resources like local teen pregnancy programs. Family support is going to be very helpful, as well as support from the dad, so that we're avoiding a single parent situation. Educational support, whether that be an IEP or support from the facility where you attend school, and just pre-planning, knowing what the plan is with your job, with continuing your education. Having a plan and a support system is going to be a huge deal at reducing risk factors such as postpartum depression and other stressors. Please pause here and take the post test. This will allow you to assess how your knowledge grew over the course of this presentation. The post test can be accessed by clicking the link underneath the video. If you have any further questions on prevention of teen pregnancy or teen pregnancy resources, I've created this brochure that can be printed out by accessing the link underneath the video of resources on the internet that you can access to answer those questions. The following sites are the references that I used to compile the information for this presentation. If you have further questions, you can access the brochure that I spoke of earlier, or you can access these references here. I hope that you learned something about teen pregnancy prevention during the course of this presentation.